The recent flu outbreak has hit Manitoba hard. Many Manitobans have gotten sick, and it actually has taken the lives of 2 people. And now I'm joined with Jason Hoeppner of the Medicine Shop Pharmacy in Winnipeg. Should Manitobans be worried about this recent flu outbreak?
Well, I think Manitobans should always be aware of the flu, and it should always be a consideration. And obviously, when young healthy individuals succumb to it, that's always a bit of a shock to people. So we've had a lot more interest, questions, people coming in the last week or so with wanting to get the flu shot or wanting more information about it.
And where can they find the information on how to get the flu shot?
Manitoba Health, on their website, they have a link to all of the locations where flu shots are offered. Most doctors' offices, pharmacies do offer it. We do recommend that people phone ahead because there are some areas or some locations that have run out of stock. So rather than get there and find out that it's not a possibility, maybe call ahead first.
And for those who think they might have the flu, what are the symptoms of this recent outbreak?
Typical flu symptoms being high fever, muscle aches, pains, and cough. Those are sort of the typical ones. People tend to be quite fatigued, chills, decreased appetite, headaches. Those are sort of the most common symptoms that people would see.
And with this latest outbreak, when would someone know if they should go to the hospital or not? What are those signs?
Sort of the more sort of high risk signs where we would be concerned, signs of dehydration. So people that aren't able to drink, people where they're not putting out any urine, those are typical warning signs. People where their breathing becomes shallow, shortness of breath, chest pain. Those are sort of the typical warning signs. People that their lips are starting to turn blue, just signs of their oxygenation being compromised. That would be an indication to get emergency help.
And with the amount of people that have gotten sick and those who actually, the 2 people that have died, has Manitoba ever seen an outbreak like this before?
I think we've had severe outbreaks in the past. This one is maybe a little worse than in the previous couple of years, so people are taking notice of it. But it is probably a bit more active flu season. The other factor at play here is that typically the A strains and the B strains of the influenza don't peak at the same time, but it seems like right now they are, as well as there's another virus called RSV, that's a respiratory virus that's peaking at the exact same time, and I think that's sort of causing some overload in the medical system right now.
And who are those highly at risk for this flu outbreak in Manitoba?
Well, everyone's at risk of getting the flu, but the people that tend to get more, sicker with the flu tend to be anybody with pre-existing medical conditions, so heart conditions, any breathing conditions, asthma, bronchitis, the elderly, the very young. Those are sort of our high-risk groups. Now, anybody can have the flu, and we've seen that some we think younger, healthy people have had severe outcomes with the flu, so that's always a concern. But it tends to be those things, sort of the very young, the very old, and anyone with sort of underlying medical conditions.
And Health Canada says that those who are 6 months and older should be receiving the vaccine. Thank you so much, Jason, for talking with us today.
Thank you.